Right. So for today lesson, we will teach you about wound and bleeding and fracture. So first, member who haven't write down your name and division, please do it now. Okay. So what is wound? Wound is a type of injury which happens relatively quickly, which skin is torn, cut, or punctured. So there have seven type of wound. I will explain it one by one. First one is incised wound. Yeah, the first picture. A clean surface cut. The incised wound is caused by sharp object such knife and something like sharp. Then you like tak sengaja cut down your hand or your skin lah. Example for razor blade, paper cut, slight knife cut. And the second one is laceration. Laceration. Crushing, ripping, force result in tear or laceration. For example, like when you go for cycling yeah, but too fast, then you saw a hot girl or handsome boy lah. Then suddenly you lose control again the bicycle, then you accident. Then your knee or your hand rub again the loose surface. So you can see at the picture, this is the pattern lah. If you rub again the road surface, like you terjatuh or you run too fast then terjatuh, like this lor. Then for the third one is abrasion, or we call it graze. Superficial wound, skin scrape off. For example, like your hand rub against another surface causing friction, or we call it in BM gesaran. In BC, we call it mortally. And grabbing a rope, for example, grabbing a rope and the rope still move hurry, like causing friction. And this example photo for laceration wound and abrasion wound. Okay, so this example for the guy jatuh lah, then get laceration wound. See your hand. Skin right again through the surface. Like you terjatuh or you bicycling too fast, then you didn't wear any protection, then suddenly you fall down or fly like a Superman, then zoom. So this is you play the tali for the in the haidukan. So example, your hand with what friction between two surface causing a slight burn. Like yeah, like this lah. You if you have tried this before, you feel the sakit lah. And for the next one is contention or we call it bruise. Rupture capillaries breathe the skin that mean like lebam in BM lah. And in BC we call it hatching. You hit the internal bleed, you smack your face lah, you smack all that on chair or very very red lah. Like you outside you cannot see the blood, but internal it got bleeding. So this is the example for the skin pattern. Contention. And for the next one, Wait, sorry. Yeah, see, no visible bleeding unless very severe. We see blood seeping out of skin. So it's not too serious. You will not see the blood. So for next one is puncture wound, a small entry but deep internal damage. For example, like staple bullet enter the thumb or nail after a fit. And for example, like staple bullet enter the thumb but didn't go through. It just like masuk sikit nya. But like paku lah, like paku. So for the next one is stem wound. Stem wound are caused by long blade or knife. Penetrating the body. For example, like the knife stab the hand, penetrating the hand. For example, like you know the game, not a game lah, like a challenge lah. Knife challenge it. I forget lah. Like the guy, what? Bring a knife, then he has to look a challenge, around his hand, his finger. Then if you miss one step, then your tangan GG lor, kena chop up. And for the last one, this one is very easy to remember because what? Because a lot of people like to play game, right? Then you can see the word gun shot wound. Bullet drive into through the body. For example, like you take a gun and you fire at your hand, you will notice that exit wound is bigger than entry wound. That means like you tembak, right? The first bullet go in through your skin. Then the lubang like very kecil ni. Then later it go through at the backside, right? You can see the lubang no lubang got lubang also. Then the wound is bigger than the first time kena one. Like the first skin go through, the go through one is smaller. No. The first kena is smaller. Entry wound is smaller. Then exit wound is bigger. For example, only don't betul-betul take a gun, then do it later I call police. And these wait okay. This is contention wound. Often it's not a blue black, bruise or hatching lebam. And this one is puncture wound. There's pointed object pin near the skin. Like you pijak paku lah because you didn't see, right? So am I going too fast? If I'm going too fast, please try me. Please tell me. No? Okay. So for now, we now moving to the next topic, which is management of cut and graze. First step, of course lah. This one must remember. The examiner will ask, first step is what? What must you do? Okay. So next topic, which is management of cut and graze. Most cut and graze are minor and can easily treated at home. And cleaning them thoroughly and covering them with a plaster or dressing is that all needed. The reason is control bleeding and minimize risk of infection. So now I will tell you guys what is the treatment. First of all, of course, wear gloves lah to minimize the risk of cross infection. Do not touch a wound with your bare hand if you didn't wear any glove. And the second step, uh, the second step is clean the wound by rinsing it with running water or use alcohol-free to wipe to clean the bacteria. Like you jatuh, right? The wound maybe got a bit bacteria or dirty. So we have to clean the bacteria. So for the third step, pat the wound dry using a gauze swab. After you're done cleaning the wound lah, then you put the wound dry using a grass swab. After that, you clean the wound, right, and the area surrounding the wound. After you're done, apply antiseptic. Yeah, you clean around the wound. After you're done, apply antiseptic. Eh, after yeah, apply antiseptic. The use of antiseptic is to kill the bacteria. After you're done antiseptic, the next step you have to do is rest and support injured part which is above the hurt level. But why? Why should we rise and support the injured part above the hurt level? Anyone know? Why? Why should we rise and support the injured part above the hurt level? Yeah, to circulate back the blood heart. Okay, it is because elevating the wound reduce the circulation to the wound area and decrease blood loss. Blood loss, sorry. But make sure that there is not any bone fracture because if you're the casualty leg, kaki patah, then you rise a leg, convert injury kawan-kawan because sakit, right? So Jerry, oh don't want sakit because don't know. So you have to ask first if have any fracture or any case lah. Like accident, we don't know which part we can see, right? And the last step is cover the wound with sterile grazing on hair. Oh, wait, I haven't show you guys. Sorry. Okay, and the last step is cover the wound with sterile dressing or adhesive dressing. And you're done. Like this only. Then you're done. Understand? Am I going too fast? Hello? Sure. Alright. Nice. Okay, wear glove. Clean the bacteria. Like clean the wound. Then put a pad. Okay, for the next one is management of bruising or contention. This method is used to reduce swelling and pain. And the first step is elevate and support the injured part in a comfortable position. As much as possible, keep the injured area elevated above the level of heart. And the next is, sorry, Why I always forget this one? Yeah, yeah. Let me repeat again. Okay, let me repeat again. And the first step is elevate and support the injured part in a comfortable position. As much as possible, keep the injured area elevated above the level of heart. The second step is apply a cold compress on the bruise for 10 to 15 minutes. No more than 20 minutes. It's got a bit danger for the leg, like no rasa lah, like sakit. Cannot too long also. 10 to 15 minutes is enough. Okay, and you all can remember as rice treatment, not nasi rice It got meaning one. Okay, rice treatment. The R stand for rest, and the I stand for ice. C stand for compress. E stand for elevate. Here all you can see rest. Put in comfortable position. Then bring ice. Then compress. Then elevate like this. This is for the example lah. You all can see it. Okay. So for the next one is management of blister. This one right is to minimize the risk of infection and prevent blister to burst. Like what is blister? Blister is like if you touch something hot like hot water right, kena your hand then you can see got a bit like bubble lah, like bubble in your finger or what. Inside the bubble got water right. There's no water. There is like something like liquid inside your body from your body. So it's better do not burst the blister or take something sharp to do it because it's quite dangerous. Can caused by can what? Maybe got any bacteria can go inside to the blister if you pop it out. Okay. As I say, blisters are most often caused by skin being damaged by friction or heat. Okay, so management blister. The method is to wash the area with clean water to minimize infection. Before that, don't ever forget. This is what examiner confirm will ask you one. What is the first step you must do if you need to clean or treat any wound? The very first step is make sure your hand is clean and you wear glove. Or not, later you don't know what to do, then the examiner confirm will fail you to because you don't know the rules to treat the like your hand dirty. Then to treat later got infection how? Right. We also don't know that the casualty got any pesakit like HIV. Then you touch the blood. Then later you kena. So the first step, the method is to wash the area with clean water to minimize the infection before that. Before that, make sure you wear gloves, like I said before. Treat the casualty to minimize cross infection. After that, gently pat dry the area and surrounding. Skin with sterile gauze pad. Last step. The last step. Last is cover the blister with an adhesive dressing and make sure the pad is larger than the blister. Or not later like got lubang there, lubang here. So you have to fully cover the blister lah. Or later got something tak sengaja pop. We don't know, right? So we have to cover it. Do not pop the blister because it's quite dangerous lah. Yeah, this is blister. You all maybe got it before. Okay, so this is the last part for wound and bleeding. The last one, so we all total have 6. Okay, management of severe bleeding. What is severe bleeding? Okay, anyone know what is severe bleeding? Anyone? Yeah, big cow, lot of blood. Like, yeah, it's like you lost a lot of amount of blood. So, for example, okay, severe bleeding is when bleeding is severe. Severe is like mean like teruk lah, very teruk, serious. It can be dramatic or distressing. If someone bleeding isn't controlled quickly, if you didn't control it quickly, they may lose a lot of blood or become unresponsive or develop shock. So the shock is not the terkejut meal. It like this shock mean like happen when your body lacks of blood, like kurang有darah lah, kurang darah flow means like the cell and organ do not get enough not organ, oxygen and nutrient to function properly. And yeah, shock does not mean the emotional shock lah. No, like you saw a ghost then terkejut, woo, hantu. No, not the shock, not the type. And its life-threatening condition often causes by loss a lot of blood. So I will show you a video because I not quite understand, not understand, don't know how to explain it. Okay, first, of course, wear glove lah, and remove or cut clothing as necessary to expose the wound. So like, if got something like to top the wound, not like wound lah, because bleeding, right? You know, kacau lah the cloth, then you cut lah. Don't let the cloth kacau you or anything. So second is apply direct pressure with dressing or ask casualty to apply it by him or herself. So the number 4 step is secure the dressing with bandage. Third step, elevate and support the injured part so that is above the level of casualty head. So the number 4 step is secure the dressing with the bandage. And number 5, treat for shock. The first step, treat for shock, is lie down the casualty. Like give in to duduk lah. Not duduk, like laying down. Like doing CPR like that lah. Lay down. Then keep warm with blanket. Then the third step is try and support his or her leg they are above the head level. Later I will show you guys a video to do it. Not do it, to explain it. So if she or he complain of thirst lah, moist his lip. Oh yeah, little water. Don't too much. Don't too much. Don't forget, don't give the casualty smoke, eat, drink, or move unnecessary. So the last step is monitor and record vital sign and send to hospital. You check for pulse rate, breathing, temperature, like that. So I will show you guys the video. Wake up, compare pressure. Okay, I will show you guys the video. Do this, Evan. Too fast. Can you guys hear it? Can you guys hear it? No. Alright, wait. Yeah.
When bleeding is severe, it can be traumatic and distressing. If someone's bleeding isn't controlled quickly,
Go high pitch sound. Wait, go to problem. Alright, wait. Which one? Don't know, like. Caption. English. Okay. So you understand?
Okay, so fracture is when your bones is break or crack. Okay. And then okay, in Chinese it's called 骨折, and then in Malay is tulang patah. Okay. So closed fracture. Okay, there is two types of fracture. It is closed fracture and open fracture. Fractured is when your bone break already, and then your bone is still remain inside your under the skin. Means you still cannot see the bone coming out. Okay. So but the breaking bone pieces will can still like because the pieces is very sharp, can be very sharp, and it may uh, pierce your organs or major blood vessels. And then the casualty may have internal bleeding and stroke. Okay. Uh, okay. Now it's open fracture. Okay. Open fracture is very easy to recognize. It just as long you can see the casualty bones is coming out from the skin, then that is open fracture. Yeah, it's kind of disgusting. Okay. And there will be wound and bleeding profusely, and the casualty will likely to suffer shock. Okay, and then when there is a wound, then there will be risk of infection. Okay, any question so far? Okay, forgive my broken English. Okay, next, signs and symptoms for fracture. Okay, first there will be deformity, swelling, and bruising at the fracture site. Okay, deformity is the shape of the fracture part, the fracture site is already like cacat already. Means the shape is not so normal already. And swelling is bengkak. Like the suddenly okay, when your leg is fractured and suddenly your leg is become like fatter already. Okay. And then bruising is okay, the fracture site. Okay. Of course the casualty will feel pain lah. Okay. And there will be difficulty in moving at the area of fracture site. Um, okay, so there's some types of deformity like shortening. The leg will be like shortened a bit because of the how to say, because the bones is already not in the original place. Okay, and the bone will bending like the first picture of the legs, and some of the limb will be twisting. Yeah, okay. And then there will be also sign of shock, especially if tight bones and pelvis. When your tight bone, you know where is the tight bone? Hello. Oh, okay, sorry. The net connect work. Um, okay. And then for the open fracture, there will be wound, okay, and the bone will be stick out. This is very easy to recognize that. Okay. 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 So far, any question? Hello. Give me some thoughts. Okay. Okay, good. And then for closed fracture, there will be two types, which is stable fracture and unstable fracture. Okay. Um, Although the bone is fractured, okay, stable fracture is when the bone is break, but it still remain in the original place. So it will be risk of bleeding or further damage. Okay. So further damage, which means it will like turn into unstable fracture. Okay. Unfractured, un, unstable fracture is the bone, then the bone is already break until it will displace easily when there is movement or muscle contraction. Like you move a bit, and then the bone will like um displace already lah. Just move from the original place. Okay, like the picture there. The first one, the first picture, it is stable fracture, and the last picture is unstable fracture. Okay, this is treatment for closed fracture. Um, First, you have to support and immobilize the injured part, of course, to stable the injured part so it won't be um, move easily and turn in and move easily, and the bone won't be easily being displaced, like move out from the original place. Okay, you can secure the injured part with sling or bandage. Okay, and remember you need to tie the knot at the injured site. Remember to tie the knot at the injured site. Okay, of course you need to call for ambulance 999, and then need to treat for shock. If okay, and then here is something different, which is do not raise the injured limbs because the bones already patah, and then if you raise it, it will cause the casualty being more pain. Okay, and the casualty will scream like hell, of course. Okay, and then you need to check circulation beyond the budget every 10 minutes. Like you need to check whether the blood circulation is normal or not, because sometimes when you tie the bandage, you will be like too tight already. It will damage the circulation. Okay, damage or weaken the circulation, like the blood flow. Okay, and there is some notes: do not move the casualty until the injured part is secured. Like you need to make sure that your um the injured part is already fixed there, like already stable already, so that you can move the casualty, or else the bone, like what I say, the bone will be displaced easily. And for firmer support, like if you want to not once like you need to make the immobilized more stable. Okay, for example, the casualty left leg is injured. You can tie the left leg with the right leg together with bandage to make the immobilized more stable. Okay, and then remember, do not allow the casualty to eat or drink because the bone patah already. Of course, it will be very pain, and it may be will need anesthetic to numb the pain. Okay, so you are not allowed to eat or drink when you are using anesthetic for like between some hours like that. Next, this treatment for okay. Hello. Okay. You must wear gloves. Okay. Can someone tell me why we must wear gloves? Hello. Can someone tell me why we must wear gloves? Hello. Okay. Good. And regulars is to prevent cross-infection. Okay. And then the first one, of course, regulars. And then the second one is control bleeding. Okay. To control bleeding, you need to insert some pressure, apply some pressure to control bleeding, but do not press on the bone, although or else the casualty will slap you because it's too pain already. Okay, and then cover the wound by processing of the bones, like because the bone already pierced out from the skin, there will be a wound, and you need clean pad or sterile dressing to cover the wound to to minimize the chance for being infected by bacteria. Okay. Number 4, clean the padding over and around the dressing. Like, okay, because when there is open fracture, they will be bleeding profusely. And then the first layer of the padding you put all over the wound will be full of blood. So you need to keep stacking up. You cannot take out the first layer because some of the blood is already turned into, like, okay, when you fall down, you bleed already, right? Okay, so like there is some, then your wound will be like fixed, like will stick the padding will be stick on the wound. So if you remove it, it will be very pain. So just stack it up and then stack higher than the bone until you can bandage all over the wound. Okay, any questions? I know it's a bit complicated. You all can understand, right? Okay, good. Okay. Next one. Oh, okay. Another one is when you bandage all over you need to bandage all over the bone to protect the bone from being inserted for any pressure. Okay, so just protect the bones only. Don't let the bones being touched by any things. Okay. Okay, and then secure the dressing and padding with bandage. And you need to use bandage to secure the padding, like what I just said, but not too tight. Okay, and then too tight, it will like impairs the circulation. Means it will weak the circulation of the blood. Okay, like okay, and then number 6 is like what you did for close fractured. You need to immobilize injured parts, and of course call ambulance, send the casualty to hospital. Okay, if there is shock, you need to treat the shock. Shock is the lack of blood. Like you need to make sure the casualty is comfort and keep the casualty warm, like that, something. Okay, and then monitor and record vital signs. Vital signs is something like pulse rates, breathing, blood pressure, like that. Okay, and then of course check the circulation beyond the bandage every 10 minutes, like how you treat the close fracture. Okay. Any question? Okay, good. And then strains. Okay, strains is when your muscle is overstretched. Okay, it also can cause muscle pain. Example for a marathon and it's like you move and then it's slowly that is called strain muscle pain, like your muscle overstretched already. Okay. Other focus the junction of the muscle and tendons that join the muscle. Okay. tendon joint. Yes, okay. The casualty will. Yeah, this is sprain. Okay. Soon being constrained. Okay. So the sprain. Okay, this is I'm sure that of the basketball player will assess this. The second picture. Okay, when you run suddenly your leg like suddenly turn, something like this. Okay, and then then there is ligaments near to our joint to um, allow us to like turn around like turn here like that. Okay. Then suddenly unexpected range motion that pulls the and then suddenly your leg is already suddenly like something happen like picture two, then your ligament being stretched, being tearing, and then oh my sorry. From to hear my voice very dark. Just to relax. Since when my voice become very oh okay. I repeat the strings okay. So the string is when your muscle is overstretched. Okay, for example, and now you can hear. Holy. Wait, let me check. Hello. It is clear now. It is clear now. Hello, hello, hello. Testing 1, 2, 3. Oh, okay. Okay, okay. Good, good. Maybe it's my Wi-Fi lag already. Okay. So let me repeat the strains. The strains part. Okay. Strains is when your muscle is overstretched. It's overstretched. Okay, like your muscle being pulled for too much. Okay, and then this happen when you run for the marathon. Okay, you can for those who like ran marathon before, you can like after a few hours you finish your marathon, you will feel like your muscle, your leg there is like very pain, and when you move, it's very like a bit soaring. Okay, and then this is called muscle pain lah. This for strain lah, but that it but this strain is more like a bit more serious than what you experience. Okay, and then but usually the strains is very mild only lah. Okay. Okay, now this is sprains. I know it's rhyme, but it's sprains. Okay, sprains is the tearing of ligaments. Ligaments is at near to our joint, like the first picture. You can see the label of ligaments. Okay, right. I'm sure that some of the basketball player experience the picture too. The picture too. Like suddenly your leg chacha already and turn into other side, and it will be very pain. Okay, so you can recognize the sprains when the pain is noted all over the joint area. So when your joint area is pain, there is sprains. Okay. The casualty will normally experience difficulty in movement. Like when he move, it will be very pain and very hard to move the leg lah, the leg, because the joint there is already injured already. Okay, and of course, like the strain, swelling maybe will be there. Swelling maybe will be there, like bengkak, maybe will bengkak. Okay. And then it is like very hard to differentiate with fracture, because fracture also will bengkak. Okay, so it will like quite hard to differentiate between sprain and fracture. Okay, this is the treatment for sprain and strains. Okay, the aim to treating the sprain and strains is to reduce the swelling and pain. Like the treatment can't cure the sprain and strains, but can let you feel more comfortable, like to reduce your pain lah. Okay, and the treatment is also same like previous wound, like rice treatment, bukan nasi ah. Okay, and then R is to rest the injured parts. Okay, to rest the injured parts. Don't let the injured part like move here, move there. Okay, and then use ice to compress. To compress, it can reduce swelling and bruising and pain. Okay, and then you need to compress and support the area with thick layer of soft padding. Okay, and just to macam mana explain ini? Okay, compress and support the area, like same as the rest. Like don't let the broken part, like when you suffering sprain. So you need to compress and support the injured area, so it won't be move here, move there. Something same like rest the R. Okay, and then elevate the injured part to reduce the flow of blood to the injury, to minimize bruising in the area. Injured part, the blood will flow back to your brain, and then your leg will like less blood, so it can minimize the bruising, because bruising is where the blood is like all gathered at there. So you need to reduce the blood at the bruising area, something like that. Okay, cramp. Okay, cramp. I'm sure that every one of you has experienced this. Like after marathon or in the middle of the night, suddenly your leg very pain, like your muscle is tearing apart. Okay, so yeah, definition of cramps is a sudden painful spasms in one of more muscle. Okay, sometimes your calves there will be very pain, like just very pain. Like I also don't know how to explain the pain. Okay, and then the symptoms of cramp is of course very painful and swelling over a muscle group. Yeah. Okay, this is the treatment for cramps. Okay, for the first aider, they will use this to treat the cramp patient, usually after the marathon run. Okay, cramp at the foot, like at your foot, you need to help the casualty to stand with his weight in front of foot. Okay, like the second picture, like put your leg on you on your on your what the hell? Okay, just like ayo, macam mana explain like this on you. Just like something like you help the casualty to massage their feet. Massage their foot. Sorry, grammar. Okay, and then just like the picture two, you can follow the picture two and then help them to stretch their muscle. Okay, this can help to relieve the pain. Of course, when you stretch their muscles, they will be very pain, but after that, it will like not so pain already. Okay, and then cramp on the calf is something like the first one, but your other hand must be like massaging the calves. Okay, and the another hand will be help them to stretch. Just push the foot to the direction of the casualty. Treatment for cramp. Okay, there's another treatment for cramp here. Okay, as you can see at the picture, the woman is helping the casualty to to treat the cramps. So you need to help the casualty to lie down and then ease the cramp in the back of the side. Okay, you need to raise the leg of the casualty at your shoulder. Okay, and then you like um push their leg into higher position slowly, or else the patient will be very pain. Okay, and then for cramp inside the teeth, the thigh need to bend the knees. You know where is the thigh? The 大腿, the upper part of the leg. Yeah, okay. Okay, and this two method is for thigh only. 大腿 okay. Something like this. Okay. Uh, yeah, I think that's all. Oh, finally. Okay, you have any question? Hello. I have to make sure you all um I have to make sure you all clear about the topic. Hello. Any questions? If no question, I will ask you questions. Okay. Okay, now I will pick someone to ask questions. What to do about the object? Which one? Which one? The severe bleeding. Yeah. The severe bleeding, right? Okay. You need to like depends on the condition. Depends on the condition. Okay. When there is like something like stapler at the wound. Okay, so this is severe bleeding, right? Okay, when there is the for example, scissors like step through the wound, and then there's a severe bleeding. And of course, you need to remove it. But if you cannot remove, then just leave it there. Let the more professional people to do it. Okay? Am I answering your question? Okay, this is a very good question. Okay, so hey, you imagine when your hand is there, and then suddenly, okay, and there is a scissors there. The treatment, you can like, you know, um, think outside the box. You can just uh, imagine that there's a bone. The bone is coming out. So you can use the treatment of the broken bones, the open fractured, to cure it. Something like this. But if scissors like that, you probably can pull it out. But there's a nail like inside the flesh. There's nothing you can do. You cannot like pick it out with bare hand, or even if you wear gloves, but it still cannot like your finger dip inside the wound to take it out. You need to use something like uh, things to clip it out. But like what you asked, the object is in the wound, so you have to just to like do as usual, cover the wound with the padding, okay, and then before you send the patient to the hospital, you must tell the people that there is something in the wound. Yeah, because you are the first aider, you are the first one to help the patient. What you can do is not to cure the patient, but to prevent the patient's wound getting worse. Okay, so my answer is you have no choice. You have to cover it, or else the wound will be getting worse. Okay, clear? Okay, any more questions? Oh, oh. No question already, yeah? Okay, now we'll wait. I think I got no question raised. Stop listening.
Okay, members that haven't write down your name in the chat box and your division lah, please do it now because we want to take your attendance. So please write down your name and your division if you haven't do. Thank you.
Okay, now as long we have still have some plenty time, I will talk about your exam syllabus. Okay, your exam is fall on 31 May. It is on Sunday from 2 to 3:30. Okay, and then the exam style is 100% in theory. Okay, not like last year got practical like CPR and bandaging. I'm not sure it will like video call, something like video call and show the examiner how you tie the bandage. Okay, so there is the exam duration is 1 hour and it is theory exam. Like the exam syllabus will cover with introduction to first aid, bandaging, wounds and bleeding, fractured, open and closed fractured, strain, sprain and cramp. Okay, make sure you all study that. Okay, as and transportation, CPR. For the CPR, there is no EAR and high quality CPR. Only the basic CPR. And then choking and introduction of AED. Okay, I'm sure that you all have learned that. If you haven't learned, like the next week they will be teaching. Okay. Okay. On the exam, okay, the exam is on 31 May. Okay, as what I said just now. And then you need to prepare 2 devices, one laptop and one phone. One laptop is for Google Meet, and one phone is scanning QR code for the question, for the exam question. Any question? Any question about the exam syllabus? Can use tablet and phone. Can. You can just as long as you have 2 devices. Do you have practicals? Oh, okay. And at the exam day, your camera, your camera has to open, so we can see what you are doing. Means we don't want to see your face. We just want to see we just want to see what you are doing only. Okay. Okay. Oh, the Renan Roche, there's no practical things, just 100% theory, just like answering the question